This is 102.3 WHIVLP FM in New Orleans. We are Radio NOLA HIV with programming. That's right, programming dedicated to human rights and social justice. WHIVFM.org. We honor independent voices. We are not a radio station with a mission. No, we are a mission with the radio station. End all wars. You are listening and watching COVID Noise Filter, the daily hour-long show. My name is Dr. MarkAlain Dery. Dr. Griggs will be joining us in just a moment. With us today, however, is Dr. Laura Cheever, and it's a pleasure to have her back on WHIV as well as NoiseFilter. Dr. Cheever is a physician and associate administrator for the HIV/AIDS Bureau at the Health Resources and Services Administration, which is an agency of the U.S. Department of Health and Human Services. And also, let me add, for which several of the grants that I've talked to you guys about, the Ryan White Part A and Ryan White Part F, for which this show is partly funded by, comes out of the Department of Health and Human Services. And as I always say when Dr. Cheever is on air, is thank you very much for giving me the ability to do what I do. But on February 7th, the HRSA, Health Resources and Services Administration, Ryan White HIV program will commemorate the annual observance of National Black HIV Awareness Day. This is an opportunity to increase the awareness of care and treatment services for Black Americans facing stigma and HIV-related health disparities, and encourage those who are undiagnosed to get tested for HIV, and if they test positive, get appropriate care and medication. Dr. Cheever, welcome back to WHIV and welcome to COVID Noise Filter Show. It's such a pleasure to have you on board.
Great, thanks for having me here, and thank you very much for the work that you do. The Ryan White program is incredibly impactful nationally because we have people working all over the country who are really committed to the cause.
Thank you so much, and it's been a pleasure. I started two of them here in New Orleans, one with Tulane University, and my second one was with Access Health Louisiana, which is a local FQHC with 40 clinics around the state. So I guess let's just first start off with talking about the significance of National Black HIV/AIDS Awareness Day.
Yes, so every year we do commemorate on February 7th, National Black HIV Awareness Day, because it's really important that we keep HIV front and center in the African American community. The African Americans shoulder a disproportionate burden of many diseases in the United States. COVID was an excellent example, but HIV persists as a disease that is really heavily carried by the African American community. One example I like to give is that in 2018, 42% of all new HIV infections in the U.S. were among Black African American people. That only represented 13% of our population. So we still have a tremendous burden there. It's not about increased risky behavior. It's about sort of where you live and what you have access to that is driving that disparity.
And we refer to that typically as social determinants of health.
Absolutely, yes.
That are unfortunately and disproportionately experienced by communities of color in the United States. And I think that if there's one I wish that we didn't have to have that, but if there's a silver lining with COVID, I find that my job has been easier in helping people to understand these health discrepancies or disparities as a result of COVID, because I think a lot of people saw it all at once. And this is something that Doc Griggs and I talk about and have been talking about for years regarding this topic in particular. If you could talk to us a little bit about Ryan White's program and the impact among Black Americans with HIV.
Sure. So the Ryan White HIV/AIDS program is a nationally funded program that provides medical care and treatment services, and we fund cities, states, and community-based organizations to do this work locally. So that the work that's done locally is really based on local planning, the input of people with HIV and providers in those communities about what they need, with the goal of providing free or low-cost HIV care and treatment to people who can't afford it on their own. And speaking of social determinants of health, we fund things like medical care and medications, and we fund medical care to medications to over half of all the people with diagnosed HIV in this country on medication. And we also fund essential support services, things like transportation to your visit if you need it, emergency housing, emergency food, those things that people that are living at or below the federal poverty level need in order to stay on their medications and take their medications every day. So it's a combination of supporting those things that we are able to have really good results when it comes to outcomes for African Americans in our program.
And I was reading in prepping for this in prepping for this interview that the Ryan White program has been very successful, specifically when we're talking about Black Americans living with HIV, and we're seeing some of the highest rates of viral suppression. And if maybe you can talk to us a bit about some of the successes with that and why viral suppression is so important for people living with HIV.
Yeah, so viral suppression is the concept that someone with HIV is taking their medication every day and drives down the amount of HIV in their body so low that we can't really measure it. And that's called being undetectable or virally suppressed. And that has two advantages. One is someone living with HIV, by taking one pill once a day, can live a near normal lifespan if they're virally suppressed. So really important. Their immune system can build back up again from some of the devastation caused by HIV when it's untreated. And second, they have effectively no risk of transmitting HIV to their sexual partners. So it's a great way to break that cycle of HIV transmission. So it's really exciting to be able to do that. In our program, African Americans who come into our program at least once in 2019, 85% were virally suppressed. So significantly higher than the national average, which is somewhere in the 60s. And it is because we really strive to provide culturally competent care and the services people need to stay in care.
Absolutely. And let me wrap up by asking about HRSA's role in ending the HIV epidemic.
Yes, so really exciting. We have the tools today to end the HIV epidemic in this country, even though we don't have a cure or a vaccine for HIV. And we're going to do it by first increasing testing. 1 in 7 people with HIV in this country don't know they have it because they haven't been tested for it. Many people think they have because they went to the ER or they saw their primary care doctor. Those places are not doing HIV testing. So you need to make sure you've been tested. And second, if you do have HIV, you need to get in care and stay in care. And we have about 250,000 people in the United States who know they have HIV and are not in care. Some of them, there's too much stigma, there's too much homophobia. There are a lot of different issues that are really barriers to people accessing care. And we need to work on getting people into care.
Awesome. And we have the smartest audience in the world here. So we have somebody who asked a question here, Dr. Cheever. Chris Middleton asked, does HRSA distribute money from the CARES Act to do COVID education like it does for HIV education?
Yes. So we received $90 million through the CARES Act back last April. And within 2 weeks, we had it distributed to cities, states, and community-based organizations that were providing HIV care and treatment to make sure they were able to do education and outreach to impacted communities. And we've seen some good results with some people that were out of care come back into care because they were worried about their health and did not want to be immunosuppressed in the setting of COVID. So we have, as you said, a couple of silver linings from COVID. I wouldn't have wished it upon us, but some good things have come out of it.
Right. And then, just I think last week or the week before, we saw the first injectable treatments for HIV. So that's certainly very exciting, where you'll be able to go in and get an injection once a month, at least to start. And I know that the idea is going to be extending those medications so that ultimately, if somebody can come in and get an injection once every 3 months or 6 months or so, that will go significantly a long way as well. And just two quick questions that one was any updates with respect to cure?
Yeah, so I think we are a long way from cure. Okay. Dr. Fauci's been working on cure for many, many years.
Right.
And we just haven't been able to get there because HIV is such a complicated virus. It hides, when someone is infected, it hides in your DNA for years and years and then pops out when you're not on medication. So it has been a real challenge for us with cure. But with the modeling we've done, we know we can actually end the epidemic with the tools we have.
We talk about our new favorite American hero here on WHIV and NoiseFilter, which is Dr. Kizzmekia Corbet, and the amazing work that she's done with mRNA vaccines. So just last question, I keep seeing that the use of mRNA vaccines for HIV, I'm hopeful. I'm wondering if you have any information at all about where we are with the use of potentially getting an mRNA vaccine for HIV.
No, I don't have any updated information. Okay. But I think we got so far so fast with COVID because of some of that early virology around HIV. And likewise, we'll probably be able to leapfrog in HIV a little bit because of what we're learning through COVID.
That's amazing. It's such a pleasure to have you here. Dr. Laura Cheever is the physician and associate administrator for Ryan White. HIV and AIDS program at HRSA. And on February 7th, HRSA Ryan White HIV program will be commemorating the annual observance of the National Black HIV/AIDS Awareness Day, which is going to be an opportunity to increase the awareness of care and treatment services for Black African Americans to face stigma and HIV-related health disparities. I can't thank you enough, as I've said many times, for everybody that's watching. You've heard me many times talk about our Ryan White grants that we have, of which one of them sponsors this show. That all comes from Dr. Laura Cheever's office. So thank you so much for giving me the opportunity to practice medicine here in New Orleans through my Ryan White Part A clinic, and then the opportunity to go and teach people not only about HIV and Hep C and other STIs, but now about COVID through my Ryan White Part F ATC grant. Thank you so very much. This will be played again tomorrow, Dr. Cheever, and we're going to clip this and play this over the course of the weekend, throughout the weekend, to continue to inform the New Orleans community on WHIV about National Black HIV/AIDS Awareness Day. So thank you so much for appearing with us.
Thank you. And the funding for the program comes from the American people. So not particularly from me, but thank you for your work.
Thank you so much. I appreciate it. Thanks for the clarification.
Bye-bye.
Bye-bye. Well, there you have it, guys. What a pleasure, an honor to have on some of the folks that really are super important with respect to HIV. These are the folks that fund HIV programs all throughout the country, of which there's several of them here in New Orleans. Doc Griggs, how are you?
I am. My arm is starting to get a little sore. How about yours?
Oh, hang on. We'll talk about that in a moment. First, let me just say hello to everybody who's appearing. That was Dr. Laura Cheever. That interview was originally scheduled for 5, but there was some shifts, and so it was actually quite fortuitous to have her here today because, again, as I said, it's the funding that comes out of her office that makes this program available. And so you've heard me talk about ATC and Ryan White Part F. Now you guys see the face and hear the voice of that person who's actually responsible for that. So it's such a pleasure. I'm glad that all of you guys were able to see that. And so hello to everybody. Thank you for all of your kind words that are coming in. Thank you. I appreciate it. Thank you for all, again, thank you, Angela, and thank you, Mignon and Elizabeth and everybody who's been saying all these wonderful things. Doc Griggs, you and I had some very special moments this morning, but before we talk about that, hear me out. Before we talk about that, I always like to start this show by making sure that we understand and know what it was that you talked about on the news today. So maybe you could help us understand about what you talked about on the news today.
Yeah, let's nice. Let's just say the morning has been consumed in the world of vaccines. Yeah. We'll segue into it. You and I had I got our second dose of the Moderna vaccine, and it was quite a ride. It was a hoot.
And I've got some slides to show. I got some pictures to show. There's Doc Griggs and I, vaccinated or getting ready to be vaccinated.
Yeah, that's a community member, Mr. 70-year-old Mr. Alvin Chapital, who he got his first dose with us off camera, and then today he came back for his second dose with us. And you see, we're strong together as a community.
That's right. And apparently the hosts or the help me out here. The reporters, the
news anchors.
The news anchors were enjoying this, and he's Rob.
Rob and Kelsey. That's Rob. Rob is cracking up.
Right?
Yeah.
Yeah, he was cracking up, and that was the whole shot right there, which I thought was great. And then I also wanted to highlight this here. This is me being vaccinated live on television, as you guys can see. That's a live shot of being vaccinated. But there was a little controversy today. A little controversy And I want to know, was Doc Griggs actually vaccinated today? We don't know. People want to know what was happening.
Yeah.
Did you read Doc Griggs really get vaccinated? I don't know, because I don't know, man. What happens? We can't see what happens. So Doc, help understand what actually happened.
Yeah, well, let's just call that a blocking issue. You know, I guess we just need to talk and walk through things as we go through them. But I assure you that I got vaccinated. I have the sore arm, and I just took off the Band-Aid to prove it. I'll tell you what's interesting, though. I noticed there was a symptom I had the first time that I didn't pay much attention to, but I've been really thirsty like all day, like since that. Like I had dry mouth all day, and I got congested for about an hour. That went away, but then I got a little tired right before we started.
That is amazing. You know, it's funny because Chris actually, who works with us at the ATC, brains behind the operation, actually was saying he drank 8 glasses of water after he left and got vaccinated Monday night. And when he got home, he was complaining of dehydration. And I said to him that I'd never heard anybody describe that. Now, of course,
if you can see, my lips they've been chapped and white, and I've just been drinking water like a fiend, like like an elephant after the rainy season.
An elephant after the rainy season. Chris, if you're still on watching, I know I saw you a little earlier. Maybe tell us what some of your symptoms have been. But so that by itself, we then know that that Doc Griggs did get the vaccine because he is thirsty. We got the second dose of the Moderna vaccine.
Can I just say that picture is awesome? I cannot. That's a pretty amazing picture. Yeah.
What is that? Is the one of you being blocked?
Yeah, that's it.
Or because I think this one, this one is rocking as well.
Which one is that?
That's me.
Oh, I like that one. That one is actually dope. I really, that's an amazing shot. That is.
And then I want to brag about my crafty wife, who look at the cufflinks that she made me. She took buttons that say Black Lives Matter and turned them into cufflinks, and so that's a Black Lives Matter cufflink that my wife made, which I think is very, very cool. So there we go. So we were vaccinated. Doc Griggs on here, and he says that he does feel validated now. Because I was kind of teasing him about his thirst.
So Doc, can we bring up real quick? I know we have slides, but just since we're on the topic, because I've gotten this question a lot. If people don't experience side effects, they're worried about whether or not the vaccine took or was effective. And I keep explaining that the majority of people don't get any side effects. Like it's 25 to 30% of the people get side effects, and some of them are more severe than others. So if you don't feel anything, it's okay, right?
Yeah, I mean, if you don't feel anything, like my dad, after I had gotten my side effects, of which I had was very profoundly fatigued for a couple days, and in fact, I don't even think we did the shows. I can't remember if we did the shows at that time. I was super tired, but my dad was like, "Well, I'm not going to get that vaccine," and I'm like, "Why? One, and two, you are not going to have those responses." And he's like, "Why?" Because my dad's 82. He's 30 years older than me, and he's not going to feel those same experiences. He's not going to have those same experiences, largely due because people who are a little bit older or more advanced in age don't have the same robust immune system that young guys like you and I would have. Now, I would say that just because you don't feel something doesn't necessarily mean that you have a weakened or poor immune system. Like Doc Griggs says, it's not everybody who feels it, but you're going to see that there is going to be a response as a result of being vaccinated, and that's just something that we just have to recognize.
Yeah, different people have different responses, not only to COVID, but to different different medications. Like everyone doesn't have the same response. So if you had none, you should feel safe in the fact that you didn't have any side effects, but you should rest assured, and you should feel lucky, but rest assured the level of protection is there. I mean, this is, it was 75,000 people in the trials for these two, and now where are we at, 40, how many million, 26 million or something like that?
I've got it on the rundown.
And we had some good questions, relevant,
right.
Very relevant questions that we could.
Miko had none, and she had her second, but I'm just going to get to the questions right now.
Yep.
It says, my 13-year-old has COVID now. He is drinks water and juice all day, but he's still dehydrated. All right, Chris, you're right. My bad. This is new to me. Any advice from anyone? He's dizzy with headaches. If I go to the emergency room again, I'm going to pass out. Yeah, Chris, Chris had an experience that was similar to that. I would say Gatorade. Pedialyte popsicles work as well. But I would try to figure out what is it? Is it 20 cc's per
kilo?
It's 20 cc's per kilo per what? Is it just for rehydration? I don't know if it's per hour. I think it's 20 cc's per kilo per hour. Yeah, if you look up with the way, and I'm sure, like, we're telling it to you from a medical perspective, but I'm sure there must be, websites that, kind of in mom or parent language will explain how much fluid a 13-year-old should be taking every hour. And I would use that as a guide to how much fluid you should be giving your child so as to not get dehydrated. And then Ayana asked, will the vaccine be as effective if you're immunocompromised and you're on meds that suppress your disease? That's a good question. I'm actually on monthly infusions. I've been very open about this from an autoimmune disorder that I developed over the summer. I don't think that the meds qualify as being immunosuppressants. Technically they are. They're monoclonal antibodies, but so I don't know. So I think that question, Ayana, is something that I think is specific to your to the disease process. But I would still get vaccinated, and I would still any vaccine protection is important, and I would strongly please make sure that you are vaccinated, because you are a bit more at risk with with that immunosuppressive disorder.
From what I understand, during the clinical trials, they did have various people with various comorbidities. The recommendation is for everyone, of course, talk to your doctor and your specialist if possible, but the recommendation is for people to go ahead and take the vaccine.
Right. Dr. Griggs, I just wanted to show you this and just be like another one of these.
So sorry.
Yeah, so sorry, Mignon. That is just, that's hard to even read. I think it's important too. Last Saturday, my coworker passed from COVID. He coded twice in 5 days. The second time, they just couldn't revive him. It took about 3 weeks from being infected to dying. I'm sorry for that, and it's just
yeah, so sorry.
This is why we do the show. We do this show because to empower individuals so that they are able to have information to be able to protect themselves. And this is why Doc Griggs and I do things like this, where we do get vaccinated publicly and openly, so as to hopefully inspire other folks to get vaccinated as well. So, Doc Griggs, anything?
I just got, that really hit close to home. I've had it happen in people that I'm very close to, and I'm very sorry that you had to go through that. We're really, really praying for you and are sorry for your loss. Yeah, that's tough.
Yeah, absolutely. So, all right. Well, I don't have any stories prepped for today, Doc. I knew that we were gonna.
No, we have enough stories. I mean, Doc, if you and I just have a conversation and deal with the chats. I mean, so as I'm going to ask here live on air, I need your help, because tomorrow we're breaking down and talking about the different variants and, of course, how they exist.
Right.
Right. Now, how do we, in a PC way, without confusing the audience, now, the general audience, talk about the B.1.1 with the B1351 with the E484K additional mutation without saying the region of the country. Like, so without being insulting, I mean, I don't know. Like,
I've been trying to figure out how to do that as well. And so I just say, I'll say like B1351. This is a variant that was originally discovered in South Africa. So I don't refer to it as the South African strain, or I will say, well, we're talking about the B117. You'll remember that one. That was the one that was originally found in the UK. Do you know what I'm saying? So that's how I will link it. So I won't say the UK strain, the Brazilian strain, or what have you. I will say something along the lines of where it originated in a soft sort of way. But I tell people too that like there are no names. You know,
right.
like I say, the E484K, I refer to that as the Eric strain because it starts with an E and ends with a K. Yeah, speaking of this, dude, show us some Oculus moves. Doc Griggs did open his Oculus.
I more than opened it, but I'm addicted to the demonstration. Like, it's throwing the airplane and picking it up, and then you launch these rockets. And then there's a drone, like blimp, that you have to fly. Like, yeah, I mean, you can do it I do it for hours. I'm trying to perfect it. Like, thank you for ruining my life. Yes.
Dude, there is, like, please get the games that I told you to get.
Yeah, I'm going to do it.
This is like, you know what this is like, dude? This is like when I kept saying, come to the shop.
Yeah.
I have an office for you. Come to the shop.
They don't. Can you share that story real quick?
You share it. It's your story.
So I tell you what. So our office is in the CAC here in New Orleans, Contemporary Art Center in New Orleans. Very, very nice museum in the Arts District. There are museums everywhere. The World War II Museum, you name them, they're there. So for months, like at least 8 months or so, he's like, Griggs, yeah, come on by, man. You got to come see me. Come by tomorrow morning and check out the office. I'm like, dude, what office are you talking about? Down the CAC. I'm like, dude, I'm not going to no museum. We got to work. I'm not working, talking about going to a museum. What's wrong with this dude? Yeah, I'm coming. Let's say that was February, January. So finally in August, he wore me down and said, dude, come by. Just come check it out. Dude, seriously, come right now. Well, I went and I saw that there's office space, very swanky office space above the CAC, and we have offices there. He's like, I felt like that movie in Trading, that woman in Trading Places, like, this is all for you. This is yours. I'm like, wait, I have an office here? Wait, seriously? And by the time he got to the second sentence of explanation, I was already at the front desk trying to figure out, all right, how can I get my key? And how do I?
So this is what that's going to be like as well. And sure. Angela says, if Doc Griggs like meditation, there's an Oculus game called Trip that my husband uses to calm down. I would then strongly recommend your husband not playing Space Pirate or Pistol Whip or
what's the
fight.
What's the Tetris game with the dolphins?
You have to ask Liana that one. Liana plays that one. I don't know what that one is.
I have a quick. Well, we can go. Maybe bringing up the variant that showed up in California. Someone asked.
Right.
I want to talk about. There's a. Well, we'll get to it. Just talking about variants in general. But I want to talk about an elephant in the room. I've now met in the last 2 weeks. I've met more social media epidemiologists.
Just recently, it hasn't been that way since March.
Oh yeah, because they say if the Moderna is only 66 and the other ones are 90 and 95, I think 66 is not the one. I want the one with the. But the clinical trials had different aims and they were effective towards the goals of the clinical trials. Like you're comparing apples and apples to oranges. When the Johnson & Johnson vaccine came out, it's not out yet. But by the time it got to this point, they didn't have as many variants like this. There's so many other dynamics and things so it's not as relative as you think. And the whole point of it is it's 90. But these vaccines, these first two that are and we need to talk about the difference between EU authorization and approved. They're not FDA approved, they're authorized to be used because we're in a pandemic. But the point is, they're 90 to 95% effective in keeping you from dying.
That's a very important consideration.
That's the healthiest thing you can do. Now, we don't know. We literally don't know whether or not they prevent you from contracting the disease because they weren't testing for it. Right. When they were coming up with the clinical trials, what they were trying to do was stop people from dying. They were trying to prevent hospitalizations, and they were 90 to 95% effective on it with 2 doses. Now, the other thing that we don't know about the Johnson & Johnson is it was 66% effective after 1 dose. They never did a second dose.
Right.
We don't know.
And then plus it was also, it was effective over 40 days.
Yeah, over 40 days. And we also know that on 1 dose each of the Moderna and the Pfizer, you're protected after 2 weeks about 52%. So if you're looking at apples and apples and oranges, there's but they haven't done the study. 66 versus 52 would be more analogous, but we don't know. So stop doing that bootleg math. I said it. I said it.
I didn't realize I was the elephant in the room. Thank you for making me aware of that.
Please stop doing that bootleg math. That bootleg math is not the same.
Did AstraZeneca conduct their trials with Transition Mind? I don't think anybody really did. I think that I think what we're seeing for 100% is that people who are dude, we can still hear you. I don't know what conversation you're having.
I'm sorry. Oh, I'm sorry.
Yeah, now we can't hear you.
Sorry, we were just talking about nail clippers for my dog. The whole audience knows. My wife's like,
I'm like, you're not on mute. The thing with transmission is that what we're seeing now is that people are testing positive after they've had a couple doses of the vaccines. And what that tells me is that they're not getting sick. But what it does tell me is that it tells me that that you can still be colonized with the virus in your nasal passages. So you're not infected. Remember, the word infection implies that the cells are being disrupted. In fact, the technical definition is tissue homeostasis disruption. In other words, there's disruption of how your tissues, your cells are. That's when an infection happens. Colonization is when the virus is just sitting there hanging out and it can't break into the tissues. It can't get into the cells because it's blocked because of the immunizations. But I think what can happen is that transmission is still possible.
Yeah. So folks, if you think about that, they might not be able to infect you. We don't know, but they can still sit there, and if you sneeze or yell, transmit to other people.
That's right. Absolutely. Yeah. And as we saw in one of our slides, if even you have a situation where you're taking a shower, remember that the person, and it went up and down this building in Korea through the air ducts. In the different apartments. In the different apartments. And that was completely aerosolized. Absolutely. So, all right, let's go ahead and let's get started. I think, yes. So essentially you become a carrier but not infected. That's exactly right. How long you become a carrier for, we don't know. I'm going to gander probably 3 to 5 days. I wouldn't be surprised if it's even less than that because the virus is not living there. And the whole point of herd immunity is that eventually enough people are vaccinated that the virus can't penetrate through anything and will eventually just be blocked. So anyway, that being said, Doc Griggs, there's some good news to report in terms of cases. We've globally reached over 100 million cases, 104,761,377. Deaths, 2,273,516. The number of new cases overnight was 457,688. New deaths, 14,778. That's about 10 people who died per minute in the past 24 hours. And we can see that we are definitely on a downswing here. Doc Griggs, I'm going to go back and say, maybe I shouldn't have let you talk me into that. Remember how optimistic I was being? Remember how I was saying how we were going to get through that Christmas crunch, and then on the other side it was going to be downhill? You remember? And remember you talking me out of that? I'm just saying, I don't know. Now, I am still somewhat cynical, and I believe that these variants are going to kick in at some point. So I'm not necessarily holding my breath, but it's clear we are definitely going down. So what are your thoughts here, Doc?
So I am following the trend that we've seen before we've seen spikes. I'm sticking to my guns. I was describing it to someone earlier. Like it's eerily quiet, and it's what happens after a tsunami. And you see the waves start going backwards slowly away from the sand, and things get quiet and calm, and then there's a large spike. I am with all of the variants, and it's particularly here in New Orleans, the hotels after February 12th are booked at 88% capacity right now.
Whoa. What? Say that again. What?
The hotels in New Orleans,
what?
From February 12th on to Mardi Gras are booked at 88% capacity.
No, really?
Okay. All right. Yeah. Anyway, I'm going to tell you now, based on what I've seen and based on what I've read, I am not optimistic in the least.
So go ahead, say it. Hear me today, quote me tomorrow.
Hear me today, quote me tomorrow. There is, I'm doing the Chicken Little again. The only difference now is we have an idea of what the original COVID virus is and how it works. We have an idea about trends. We have vaccines. We have ways to fight and things to fight back. We are battling COVID fatigue. We're battling information overload. We're battling a festive and different carnival season that some people have never seen in their lives. And just from that perspective, our city has the potential, hopefully, to hopefully not actually to really spike. And I hope that when people come here, they can understand that there's still a pandemic, and not come here and have us personally pay for the transgressions and the break others might have. You got to think there are a lot of people coming from people that are in phase 1 with higher R-naughts coming here, thinking because the restrictions are looser, that they can come and leave their COVID habits or non-COVID respectful habits here with us and leave. And it's just, I'm very concerned. I'm a very watchful eye.
And what about what Elizabeth says here, that they're not giving refunds?
Yeah, I haven't heard that, but I'm not sure. I haven't heard that, but I know what I read.
All right.
And that doesn't count the Airbnbs.
Yep, that's true, huh? That's a very good point.
You didn't notice how full the city was this past weekend? The highway was full, the streets were full, and almost as if there was like a special event going on. I mean, on Saturday, it was hard to get anywhere. And it's not like we had float traffic where they were moving or parades, just people were coming into the city. So I'm not optimistic locally. I'm not optimistic anywhere because we have variants out there and people are tired, and they're getting to the point where they're getting so much information between variants and vaccines and E4, 84K and the ABC plus the 345 and the 66 goes over to 95, one time carry the one, that they're just tired. Yeah.
All right. Well, this is what I'm putting in the chat here, what I get called about all the time. And so I'll show it for you. Vaccines and variants. Yep.
V square.
And then, of course, the video from the French Quarter. Yes. Well, listen, all I can say, this is global data, so let's continue on. This is global data. So maybe we're speaking a little too early. So we're looking at global data. The mortality, you can see, has been increasing since October. Man, it's crazy, huh? And then hopefully it looks like it's hopefully starting to go down. That's obviously what we're hoping for. Dude, look at the cases around the world. We haven't looked at this map in a while. 26.5 million. I mean, look at the circle with India at 10.7 million. They haven't reached over 11 million. They've been doing an amazing job holding back on it. Brazil at 9.2 million. And then you have Russia at 3.8. I mean, these are, then you have the UK at 3.8 and Spain at 2.8, Turkey at 2.5. So as you can see here, we've got an unbelievable number of cases. But here, I mean, just the U.S. is just far and away. This will be. We will be remembered for decades, if not in the history of COVID, the fact that we did it so bad. This is going to literally be a red stain on the memory of the United States. This big red circle will act as a red stain, especially when we look around these other countries around the world. I'm stunned by it. It just goes to show how hubris, more than anything else, hubris, the greatest country in the world, we're number one, the greatest country, we do better things, we have the best medical system, and all this stuff that we hear. And just look at that, how that hubris just you have countries around the world that are poor but just have sensible, common sense public health systems. And look at these numbers around the world and look at the United States. So I don't know. That's all I have to say there, Doc. Do you have anything to say?
The numbers speak for themselves. I mean,
yeah. They really do. Since we've last looked at this vaccine map, we've had a number of countries kind of light up, which is nice. Of course, we already saw Ecuador. Thank you for letting me know this was Ecuador. Of course, this is Brazil, Argentina, Peru, Chile here. But look, we have some countries in Africa are starting to light up. So the home country of Morocco, I've known about this. My family's been calling me up. Apparently, they have 6 options that they can choose from in Morocco. Algeria. This here is Egypt. I think that's Egypt, right, Doc?
I don't know, man, dude. You missed me. I'm in the geography classes. I need the key. I need the legend.
Right. Hang on a second. Yes, it's Egypt. Look, here it is. It's Egypt. Okay. All right. Because we need to get better with our geography here, right?
That's the homework assignment.
Right. I think this is Saudi right here. This is the UAE here, and I forgot what this is here. Israel, but again, we're starting to see more of the European countries starting to become darker blue, which is great as well. And then now we have Russia lit back up again, India as well, Sri Lanka. And then of course some of these southern Pacific countries as well. The country leading in terms of vaccinations is 58.8 per 100. The U.S. is 9.8 per 100. So we still have a ways to go with respect. And remember, the Israelis are not vaccinating Palestinians. Now let's look at U.S. numbers. So if we said 27,111,678, deaths are 460,644. Look at our case rates are definitely going down. Remember, we were at 200,000 for a long time or above. We're at 115,686. Unfortunately, deaths continue at 3,707 with 2.5 people dying per minute in the past 24 hours. So, Dr. Griggs, if we've got about 3,000 to 4,000 deaths per day, right? If we multiply that by 10, let's say 3,000 deaths per day, that's times 10, that's 30,000 times 1 month, that's 90,000. I mean, those estimates are correct, and we are seeing these estimates to be correct. That we said that by the end of the month we were going to see about 90,000 new deaths, and dude, look how fast we are rocking through 500,000. We are going to be
2 weeks, 500,000.
Yeah, I mean, we are skyrocketing right now. It's just unbelievable. I mean, we are going to be surpassing the number of deaths for influenza, which is between 500,000 and 600,000. Here is what the 7-day average looks like. So we are well on our way of coming down. Cases fell down 15.7, deaths fell 16.1, hospitalizations have fallen as well. Test positivity is 5.7. That's amazing. That's the best I've ever seen it. And testing has gone up.
Yep.
And as we look at where we are per 100,000, we're at 42 per 100,000. Doc Griggs, we are seeing a trend going downward significantly over 7 days. We are seeing a trend go downward over 7 days. I just want to give you one more chance to see if whether or not you concede that this is going to be a process by which we are getting better, or are you holding with the idea that things could get worse as we move forward?
I'm holding with the idea. Look at what are the numbers in California and Los Angeles?
I don't know off the top of my head. I think they're getting better, right?
I'm sticking to my guns.
All right. Elizabeth says that she saw a tour bus that looked like a streetcar at a house float today, and 10 people got off carrying hand grenade drinks, and none of them were masked. Yeah, Doc Griggs, you were right. I love the look. Dude, you should just see. You've got "I told you so" written all over you.
I don't, like I said, I don't know about the fancy charts and the numbers and the formulas and all that, but I know what I see in the street, and I know what I see in the community, and I hear. It's just, yeah.
Israel's supposed to be giving vaccines for Palestinian frontline workers. I heard that they're not doing that, and it's very problematic. It is a terrible concern. I just wanted to go back to this just to say this is concerning, and as these house floats now are going to be the main attractions for Mardi Gras, I'm afraid that they may now start gathering groups of people as well.
Yeah, show the next one. Show the comment from Ayana.
From Ayana, she says, ESPN just reported that a Kansas City barber had 20 people in line when he tested positive. All right.
Those are pretty charts. Those are pretty numbers. That's pretty. I'm just saying.
The U.S. daily, we were looking at the 7-day. This is the daily curve going down. 30% deaths are coming down. We're up still a net positive 2%. Hospitalizations are going down as well. So you can see mortality going up since November or so. Hospitalizations are definitely going down. What's that?
Just think about it. So if this is really the trend, right? And this is obviously really the trend because these are the numbers and these are the charts and this is this. Why are we in why is everything ramping up to urgently get as many vaccines in people's arms as possible? Why are we ramping up on PPE? Why are we acting as though we're at the very beginning of, like we did at the very beginning of this thing, with that sense of urgency if things are really on the mend and we're on our way that far, that drastically back to normal? That slope of that curve is amazing.
Yeah. I mean, I think that the reason for that, Doc Griggs, is because it's just the right thing to do. So even though things are getting better, it's just still I've
never heard. Have you heard Fauci say things are getting better? Have you heard any of these press conferences? It's at 10 o'clock Central.
I mean, yeah. Have you been watching the daily pressers?
Mondays, Wednesdays, and Fridays at 10 o'clock, specifically for COVID. And then I've been watching the dailies. I mean, I've heard. I mean, I haven't heard that. Great news, y'all. I mean, what I did hear is that our vaccinations exceeded the number of new infections at one point per day. I think that happened today or yesterday, was it? That was good news, but I have not seen a smiling Fauci or anyone in our public health or healthcare realm say, "Hey, we're doing it. Good job. Keep it up. We're winning this thing." Everyone is fighting as though we're backpedaling and trying to stay ahead of the virus. And it's behavior change that we keep having to insist upon. A lack of, I mean, what's the percentage of people that have been vaccinated now in our country?
I think it's the slide after this. You want me to see? It's the slide after this. No, just as cases are going down, hospitalizations are going down, and hopefully we're starting to see a decline in deaths. In the U.S., there's been 33.7 million doses passed out. That's 1.32 million doses per day. And as we
amazing.
Said, we're at 10.3 per 100 people, which is great. But globally, there's been 104 million doses as well. And we are vaccinating 4.22 million doses a day, which is amazing, right?
Yeah.
And in Louisiana, we are still, you could tell just by looking at this graph, we have some of the best vaccination rates in the country. For some reason, Idaho and Alabama still are still struggling. Louisiana, 10.5 doses per 100 people. So we're right at the we're right where the country is at. What the country at 10.3. So we're right where we're right at the national average. 8.3%. I'm going to say that this really should be 8.4%. Got their 2.3% are fully vaccinated. I'm including you and I. And Mr. What was it, Mr.
Shapatal, Mr. Alvin,
Mr. Alton Sapaton were vaccinated today. So again, this is very good news with respect to that. Let me stop and say thank you, Dr. Cheever. You guys all saw Dr. Cheever today. She is the one who's in charge. And you saw her humbly say, "This is the American people's money." She goes, "It's not me." So I thought that was very sweet. As she was just basically correcting me today, and she was humbly deflecting the responsibility for sponsoring the grants that she does. But the grant that sponsors this show, the Ryan White Part F ATC, is directly out of her office. And again, as the ATC likes us to remind y'all, that COVID-19 and HIV have the same risk factors, and for me, poverty is one of those major drivers for that. Here in Louisiana, we have 406,235 cases. Deaths are 9,006. We added 2,603 cases last night, 41 deaths. And here in Louisiana, we definitely came down. Now the question is this going to continue coming down, or is this going to form a plateau? Hard to say at this point. We don't know. Deaths are slowly, still on the rise. Here it says they're -6%, but that does not look like that. Looks like a trend upward. Hospitalizations, fortunately, are going down as well. And then if we look at the number of new cases from the last time we were here, 54.8, we're at 48, so we're much better. Our infection rate more or less is the same. Our test positivity has gone down a percentage point, and the number of vaccinated was 6.7. Now we're at 8.1. That's super great news. Orleans Parish, we're about 37 per 100,000 cases, which is great news. And here you could see this has gone down. Daily new cases has gone down per 100,000. The infection rate has also more or less stayed the same. Test positivity, apparently, today the LDH released it, and it's under 5%, which is great news. And we don't know the number of vaccinations. Before we sign off, I do want to show you guys something that came to our attention just a couple of days ago, and that was this great infographic that some students made. Doc Griggs and I were on a panel, and they took everything that we said in this infographic. They took everything we said in the panel, and they turned it into the infographic. So here's the trifold pamphlet. And so here's the first page. Here's the second, third, and fourth page right here. And you can see, because we made a big deal about Dr. Courbet, and if Dr. Courbet We have reached out to Dr. Corbet. We were hoping that we would hear back from her. We still love to have her on the show if possible. Dude, how much when she started talking about Dr. Fauci, Dr. Seaver, I so wanted to ask. I'm like, right, you know Dr. Fauci, tell him to come on this show. It took every ounce of like.
I thought you were going to do it. I was like, I know he's going to do it. I know he's going to watch. He's going to do it. He's going to do it. Watch. No, he didn't do it.
Just to get through these real quickly. Kay says, I don't know why so many people refuse to wear masks and social distance. It's a mystery. It's become a cult. Unfortunately, that is certainly driving why we have so many cases. Ayana says, to be clear, it was the Kansas City Chiefs barber who were pulled, and then 20 people, including players and staff in line. Well, are they supposed to be? These were players that were supposed to be in the Super Bowl?
Yeah, There's apparently if they pulled him, the players didn't. He didn't get to those players, which is good. Yeah.
Oh, he didn't get to.
Yeah, from what I'm reading is they pulled him, but he had people in line like the quarterback and all those other folks.
So could this just mean that Tom Brady just like walks into like Super Bowl history, or?
Well, if indeed they were exposed to him, but I think they headed it off.
Or what would they do with it? You think they would just cancel the game and just punch it for?
No, they would have to play with who they had. Like,
really?
Yeah.
Who are you rooting for?
The Saints.
1% of Louisiana residents have been vaccinated. I don't know, Elizabeth. According to those graphs, I think it was a little bit more. Would you post that on your? Yes. I'm just waiting to get permission, and if so, then yeah, we will definitely be posting those that trifold on our pages. And then thank you, Elizabeth, for your kind words.
Thank you.
Dr. Griggs, that is what I have for a show. Any thoughts, considerations?
No, we're just going to wait and hope, really, really hope that none of this, I hope I'm wrong. I'm really rooting to be wrong.
With respect to?
Well, just the fact that there's a storm coming. That this is the quiet before the storm. Someone described everything as eerily quiet,
right?
And it is. I just hope that we're wrong. Hope this is we're sailing towards the end. We need to allay some of this vaccine anxiety, folks. This is early on in the vaccine process. By the time it gets to the general public, by the time it rolls out, I think things will be a lot more in order. We'll have a better idea about variants and coverage and the whole nine. Just we signed up to be in the middle of the science experiment, and there we are.
I don't know if you guys saw the second hit that we did where I kept trying to punch Doc Griggs' arm.
Oh man, you're a fat lip. You're a fat lip. I'm gonna do that. You know what? Meet me in the ring on the virtual boxing.
Well, you gotta
meet me at Oculus, man.
You gotta get it first, man.
I'll get it. It's going down.
Anyway, thank you guys so much. We got to go. And no show tomorrow. I'll be traveling tomorrow, and I will explain where I end up on Friday. It's a little bit of a surprise. So no show tomorrow. I'll be traveling, but we'll be back to a show on Friday, and then we'll be back to our regular shows next week. Thank you guys so much for tuning in and for supporting us here on what we do on COVID Noise Filter. And remember, health is a human right. Get checked, get fit, get moving, and peace out, everybody. We love you guys.
Breathe, check, step back, get vaccinated. Bye, y'all.